I'm assuming there's a whole range of knowledge both about Rett syndrome and about AAC in the group. I'm probably going to go over some things that a lot of you already know, but hopefully you'll get something from it. So, and hello to Team A back there. It's nice to see you. Okay. So yeah. All right. So I think this is pretty much what Christina just went over. I was in the public school system for 24 years. After COVID came to an end, I decided I did not want to go back to the public school system. So at that point, I was just doing private practice, myself and Jennifer, and then in 2022, I decided to start my own practice. And really, the only reason I did that was because I needed a different tax structure than Jennifer did. So we had to kind of split a little bit so I could manage the tax system in Canada a little bit better. So, so right now, I am sole proprietor of AAC in the Grove Communication Services, and Ms. Kayla, who will be here later, is my employee, and she does my social media for me, and just general educating people about AAC and Rett syndrome. So, let's see. Okay, yeah, so AAC in the Grove. 2022, again, I decided I would start. I'm based in Langley, BC. Myself and Kayla Walker, and I focus on AAC pretty much exclusively, especially complex communicators. So right now, 75% of my caseload would be eye gaze users or switch scanners. The other 25% I would say are direct selectors, so they can use their fingers and they're probably using touch tap. So, and I also have a range of adapted play toys that can be rented out or bought. So on that note, I actually have to go back just for a second because they will be available on the website, which I haven't actually launched yet because I haven't had a chance. So that's coming though. So if anyone's interested in adapted play, adapted toys, we do that at home. Super easy to do. If you're a parent and you've tried looking for toys to purchase for your child, you'll notice that they're ridiculously expensive. You can adapt a toy for about $2. So we started doing that, and we just rent them because you're going to get sick. Your child will probably get tired of a toy, and then you're going to want something new. So we feel like this is probably a better option for a lot of parents. So keep an eye out for that. Okay. So I have this little quote with a bad animation. This is Beaker. If any of you remember the Muppets, yeah. So sometimes even famous people can benefit from AAC because I have no idea what he's saying. Apparently he's really smart, he's a scientist. Yeah. So what I'm hoping to cover with you today, we've done our introductions. I'll talk a little bit about what AAC is. We're going to do a quick Mentimeter, and have you guys done a Mentimeter before? Okay, you just have to use your phone, your tablet. I'm going to give you a login code. And it's like a quick little poll, and then we're going to do another one a little bit later, okay? We'll talk a little bit about what is Rett syndrome and what are the features of Rett syndrome that will affect communication. We're going to go over the myths and misconceptions of AAC because these are extremely important for you to know. Then we'll talk about principles of AAC implementation and how these shape our expectations, okay? So, according to ASHA, which is the American Speech and Hearing Association, augmentative and alternative communication, or AAC, which I'm going to say from now on, I'm just going to say AAC, okay, is an area of clinical practice that supplements or compensates for impairments in speech production and comprehension. Okay, so it includes spoken and written modes of communication. And it encompasses various tools and techniques. So signing is considered a form of AAC. Gestures are considered a form of AAC. There are tangible objects can be used to communicate. Picture symbols are used to communicate. And speech-generating devices. Okay. AAC can be augmentative. So So in this case, there is some speech, and we're using tools and strategies to supplement that speech, okay? And sometimes it's alternative. When there's no spoken language and no capacity for spoken language, we can use AAC to provide some need to communicate. It can also be temporary. So for instance, in the case of a head injury or a stroke, someone may need to use AAC while they're recovering their ability for spoken language, okay? But what AAC is truly multimodal. We want our kids, our adults, to use every available means that they have to communicate. It's not just one thing, okay? It's not just using a speech generating device. There should be various tools and strategies available for a child to communicate. Okay. So, AAC could be signing and gestures. Eye gaze. Eye gaze is super important in this population, right? And very intentful. And it could be texting. Texting in written language. This is also eye gaze, but now you're using a low-tech eye gaze system called an E-Tran or an eye gaze board. This is an object schedule. Also AAC, also communication. Choice boards are communication. They're a tool. They're not a system. Okay, a choice board alone would not be enough for anybody to develop communication or language. It's just a tool in a toolbox. Okay. So this is another form of low-tech. Anne-Marie, who just popped in, is going to be talking to you about low-tech communication and getting started. So this is called a pod book. A pod is a low-tech, robust communication system. Okay, it's got a lot of words, you turn pages, it's dynamic. It's a form of communication known as partner-assisted scanning. Okay. This is an eye gaze pod. So you see that little window? You're looking through the window, so you can see where your communicator's eyes are pointing. And this is just a little photo album with some words and pictures and for choice making, or probably PECs, which again is not a robust system, but it is a tool in a toolbox. Okay. Oh, and then there's our buttons. Anne-Marie, I think, has also brought some buttons. So yeah, okay, for you to look at. Yes, no. Developing a yes, no is important. It's an important tool for an AAC communicator, particularly with Rett syndrome. It's usually fairly easy to develop in this population, and it's super useful. And there's a lot of actual controversy out there about using yes, no. I just read a post earlier this morning about why do SLPs want yes, no to be developed? Well, yes, no questions can be hard, but a lot of kids, when you hold up two things and one of them is the one they want, do you want this? They're looking at it. Oh, I see you're looking at that. I think that's a yes. You just start to shape it, because honestly, there are times when you're not going to have that high-tech system, right? And you're going to want to know. You're going to want some kind of response that indicates a yes. So it might take a while to develop a yes-no, but it's very, very, very worthwhile to do that. A lot of the kids in this population, they're going to look at you for a yes. Okay? But obviously using a symbol and attaching that yes to a symbol would be helpful for more people than those familiar with your child looking at you for a yes. Okay? So yes, no is actually also very important if you're talking about partner-assisted scanning. So if you want to use a pod system, you're going to need a yes, no. Okay, so it's really, really important, I think, in my opinion, my humble opinion, that we start developing a yes-no with this population, as well as with other populations of kids who have really complex bodies and no spoken language. Okay. And then there's literacy. So these are the books provided by Rett UK for developing literacy skills. There are keyboards with prediction. If you are literate, you can say anything you want. You are not limited by the words in your device or the words in your book. If you can spell, there's nothing you can't tell someone. Okay, so literacy is very, very important. And we also know that with this population, they do become readers. These girls can learn to read, they can learn to spell. It's hard work, but they can do it. And it's really, really worthwhile to invest in teaching a child to learn to read, no matter how complex their bodies are, okay? So that's also a form of AAC. And then there's our high-tech devices, which are wonderful, and there's more and more of them coming on the market every day, and the technology is just getting better and better. And you guys are going to be able to see a lot of those in the back today if you haven't had a chance already, okay? And all together, all of those things together create an AAC system, all right? Okay, so now we're going to go to Mentimeter. So what you need to do is on your smartphone, your computer, your tablet, just go to, I think it's menti.com. Jennifer, mentimeter.com or menti?
I think it's menti.com.
I think it's just menti.com. So don't go to Mentimeter. And then I'm going to give you a code. And your code is, once you're in there, actually just let me know. Code is 1881. You're going to see it in just a second. Oh, it doesn't get any bigger than this, goodness. 1625. Okay, and it's just, this one's just a simple yes, no. I'm crossing my fingers that this is going to work. Worked for me at home. So once you get your code in, the question is, do you think your daughter or client, and it could be your students, change that word to whatever you need it to be, is ready for AAC? Yes or no? Okay, almost everyone is saying yes, because I don't think we have any more than... Everybody have a chance to answer? Great. Okay, so we have no no's, which means that you don't need to do the next question, because the next question was, if your answer is no, what do you think is holding her back, her him back? Okay, so that's awesome. You guys are all here because you know your child is ready. Okay. We didn't get to make a word cloud. But that's okay, because everyone said yes, you're ready. Okay, so Rett syndrome. I'm not going to spend too much time on this. I want to talk a little bit more about the features that are going to make it hard to communicate. So Rett syndrome is a rare genetic syndrome that affects about 1 in 10,000 live births, and it mostly affects girls. It's very rare in boys. There's a period of normal development, followed by a period of regression, which can take it can take a while. It can be spread over a while. Okay? The classic form of Rett syndrome has 4 main criteria and 11 supportive criteria. And then there's atypical Rett syndrome, in which you can have 2 out of 4 of the main criteria and 5 out of 11 of the supportive criteria. And we'll go over, because the supportive criteria are the ones that really kind of affect communication. And in 95% of cases, the MECP2 gene is affected. Okay, and that's part of the clinical diagnosis for Rett syndrome. So the 4 main characteristics: partial or complete loss of functional hand movements, partial or complete loss of spoken language skills, apraxic gait or no ability to walk, and the presence of stereotypic, repetitive, and non-functional hand movements. So right away you can see right there from 3 of those, there are 3 really big factors that are going to affect communication, right? Not being able to use your hands in a functional manner, and partial or complete loss of spoken language, okay? And then some of the other supporting criteria, people just keep walking in, that are going to have an effect on the ability to communicate. And I think these are important for our teams that are here as well to know and to realize, because I'm not sure that they always know what all the different factors are that are going to affect communication throughout the day, right? So there's altered muscle tone in almost all instances, right? So a child can be hypertonic, which is too much tone, so really tight, or hypotonic, which is not enough muscle tone, all right? And so what these do, and actually I think this can change throughout the day. I think you can go from being hypertonic to hypotonic and have a dystonic episode in there as well. So if you have too much or too little muscle tone, it's going to affect positioning for eye gaze use, right? It's going to, sometimes it's hard for a child to maintain that position. It's fatiguing, okay? And then there's sometimes the ability to just voluntarily control muscles. That's a big one, right? If you cannot make your muscles do what you need them to do, even though you know what you want it to do, it's frustrating and it affects communication, okay? And if you're here because your daughter is using an eye gaze device already, or you're hoping to use an eye gaze device, positioning is really important for successful use of an eye gaze device, okay? And then the other aspect, like it's not just positioning, but there's a lot of movement sometimes, and that is just very fatiguing and affects the child's ability to just even sustain an interaction with a peer or a caregiver, right? So all of those things really affect communication. And then there's dystonia. Those are the involuntary movements and contractions. And these, I feel, is what most parents refer to as a Rett episode. So that's when, like, all those uncontrollable movements, they can last for varying lengths of time. They can go, you know, they can be really quick, or they can go on for minutes. And that is just really fatiguing for a kid. It's really fatiguing. You cannot really successfully communicate when your body is moving so much and you have no control over it. Okay? Apparently the dystonia can sometimes be painful. So that's another factor that affects your motivation, right? Your willingness to interact, and just the energy level that you have. And of course it affects positioning. Sometimes our kids can become locked in a posture, and then you have to wait, and again, it's fatiguing, right? So that takes its toll on the demands that we place on our kids to communicate, to learn, to interact throughout the day. Hand stereotypies. So there's that constant wringing of the hands, bringing the hands to the mouth, and just uncontrollable movements that really affect the ability to access objects, but also to use your hands to select on a communication system, right? Often pointing and using your finger is not an option, okay? And I personally, I do have one little girl, she's very atypical Rett. She uses touch chat with her fingers, and I have other students that have more of a whole hand movement. And so they can get to a symbol if it's big and isolated, like they can get to a yes, they can get to a no, but they can't do this in direct select. Okay, so then that becomes an access method that's not accessible to them. We're going to have to find another way for this child to communicate, right? Oral motor skills are also impaired. So this not only affects speech sound development, but also affects eating. And it's a cycle. If you're a speech pathologist and you're in this room, you know that from birth, everything that child is doing with their mouth is paving the way for speech sound production. And so when that becomes impaired, it also affects the ability to produce speech sounds. Okay? And there's also the apraxia and the dyspraxia. Those also affect the ability to produce speech sounds. So apraxia is basically your brain knows what it wants to do, but it cannot make the muscles do what it wants to do. Which you can imagine is frustrating, right? I know from working with these girls that they know exactly what they want, and a lot of times they know what the words are, but they just can't. It's just so hard for them to control their bodies to get the messages across sometimes, okay? Breathing difficulties. So there's breath holding, there's air gulping, and hyperventilating, and not only does this cause anxiety, but it can cause fatigue. You have to wait, like if you're working with this young person who's going through these breathing difficulties, you've got to wait. You're not going to put demands on them to communicate during that time. You have to wait for that to pass. And sometimes with the air gulping, you'll need to do, the child might need venting after that, right? Because it becomes so uncomfortable, the air buildup in the belly, that you need venting. So all of these things that you have to deal with throughout a school day, throughout a therapy session. The skeletal issues, so 80% of girls will have some form of skeletal issues, scoliosis or kyphosis, and again, that's going to affect positioning, and it's going to be fatiguing and painful. Okay? Apparently the animations on this one didn't work. Okay. Oh, they did, look at that. I forgot some. Okay, so seizures. I don't have a percentage actually for how many of our girls go through seizures, but I think it's quite high.
80%.
It's about 80%. Yeah, it's about 80%. They can happen at any time. They cause fatigue and decreased alertness. And of course, when they happen, there's decreased opportunities for interaction and for communication. Sensory regulation. Girls can be over-responsive, or it worked yesterday. Over-responsive or under-responsive, and so you have to spend some time just getting them back to that sweet spot, so that they are, you know, more, they're regulated and ready to communicate and ready to learn. Okay? Yeah. Yes.
So I don't think this works. Anyway, scream loud if you can, as loud as humanly possible. Tiffany's going to go downstairs and see if we can get something to replace it. But okay, there you go. So the over and under regulation can also happen like within a short time of each other. It can happen all through the day, and you're kind of dealing with that throughout your session and throughout the school day as well. Okay. Apraxia, dyspraxia. So it's the inability to turn an intent into an action. Okay. Again, like I said, I know what I want to do, but I cannot make my body do it. Okay. Dyspraxia is the inability to do it. Apraxia is difficulty. Okay. And this is.
You did it back.
I did do it back.
Yes.
Dyspraxia
Dyspraxia is
difficulty.
apraxia is whole.
Yeah. And this is a reality, right? You can almost always when you put a direct demand on a girl with Rett syndrome, the apraxia kicks in. Right? So, and I learned this the hard way with Miss Kayla. You totally have to readjust the way you speak, so everything is indirect, because if you go at it direct, there's that shutdown right away, right? just hard to hear you.
I know.
Okay.
I need to exit again. Just give me 2 seconds here. Okay, so we're going to do some myths and misconceptions right now. Okay. Because these misconceptions can really be damaging to the communicative journey that a child takes, okay? So if you can go back into Mentimeter or menti.com, and this time your code is two 6112. Yeah, I'm not sure why we have 5. People are already answering. Oh my goodness. Okay. A child can be too young for AAC. True or false? You guys are here because we know you are. And it doesn't want to turn. Don't want to turn with my clicker. Okay. There are prerequisites that must be met before AAC can be introduced to a child. True or false? No, it's just because I got rid of option 2, and now option 3 is it's okay. True or false? Yes, I see what you mean. It doesn't say false. Okay, so there's a story behind this whole Mentimeter thing. I think there are a couple more people. Is everybody ready? Okay, so most people think false. Okay, pretty good. 4 of you think true. There must be prerequisites, right? This looks pretty complicated. AAC will stop speech from developing. True or false? Good. False. It will not. It will not hinder it. My child talks, she doesn't need AAC. Awesome. You guys are rock stars. False, of course. There are lots of kids out there who have some language. There are kids who have a lot of echolalic language. And they all benefit from AAC because AAC is just another way to support language development and speech development, right? So there's no such thing as, you guys already did this one? There's no such thing as my child doesn't need AAC. So high-tech AAC is better than low-tech AAC. False. That's right. Because we want a whole range of tools and strategies in our toolbox. And high-tech AAC is great, and it's great for you don't answer yet. I'm going to go forward, but don't answer yet. It's great for so many reasons. But you know what? Sometimes it breaks down, and you got to send it away, and it's got to be fixed. It doesn't always go in every environment. And there are times when your AAC communicator probably can't use that device, depending on where their body is or how they're feeling. I know I've had times when the AAC communicator was just so anxious that there was no way they were going to be able to use that device. And so then it's great to have other ways to communicate because you can say, do you want to use your device right now? No. Okay, do you want to use your book right now? Yep. And sometimes it's just, do you want me to just ask you a yes, no question? Yes. Right? So it's great to have different ways and not to feel like I can't communicate right now because I just can't access that device. Okay, so a person should only use one AAC system. A strategy maybe? What do you think? Right, because like we said, sometimes one of those is just not going to be an option. So if you only have one, then you have no options. Okay, we want there to be options. AAC should be a last resort. So you should take your child to speech therapy and you should have them drilled on speech sounds. And we're not going to do AAC until we've just exhausted. Right, false. We're not going to do that. Right? That's ridiculous. It's a ridiculous notion. But that's how people used to think. People used to think that, no, we're not going to introduce AAC until we've tried speech for like 3 years. Okay? A person must have some quality of motor skills to use AAC. Oh my gosh, you've already got it so fast. Right? In this day and age, with technology being what it is, absolutely false. Okay? And I'm sure you've all heard of, have you all heard of the disorder of spinal muscular atrophy? Have you heard that? Yeah, some of you are nodding your heads, yes. So I have a client who has spinal muscular atrophy, and literally all he can do is blink his eyes and raise his eyebrows. And his language is absolutely age appropriate. So can you imagine if he had to have motor skills? He'd never communicate. So no, we're not at that stage anymore where we need any kind of motor skills. Low-tech AAC should be tried before we even consider high-tech AAC. What do you think? True or false? Okay, so 3 of you said true, and 13 have said false. There's no need to do low-tech first, none at all. Okay, there are some real benefits. Again, okay, I have to sit down for a second. To having low-tech AAC, and we're going to talk about those. Okay, but I guess basically, oh my gosh. Basically, you do not have to start with low tech. You do not have to start with going through years of speech therapy before someone says, oh, okay, we've tried this, now you can have a device. We're going to talk about the fact that there are no prerequisites. The principles of AAC implementation include absolutely no prerequisites. Yeah?
You say that, but Kaya
Yeah.
made prerequisites. Kaya, your kid had to be able to demonstrate that they can make choices
Yeah.
before they would provide AAC.
Yeah, and they're not alone in doing that. And I don't want to say too much about it's not just Kaya. I think the reasons why these institutions do that is because they actually can't provide AAC to everyone. I think it's just financially, fiscally impossible to do it. And so they're putting in, that would be my guess, right? They're trying to figure out who is most ready. We don't agree with that. You're not going to find, I think, a speech pathologist in the room who thinks that that's okay. And we can all tell you stories. We can all tell you stories about what's happening, how kids are being denied access to communication. Yeah. 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 There are no prerequisites. Sarah, I'm going to show you the slide after this one. We'll see. There should be access at all times. There should always be access to AAC, and that's why we need to develop a system and not just have one thing, okay? It should be multimodal. So whatever ability your child has to communicate, we want to harness that, okay? And we want to presume potential, right? We're going to go over all of these now, because these I think are important for anyone who's got a child in a school system or in the adult system, and anyone who's working with a child in the school system, okay? Because these inform our expectations. They shape what people believe a child can have and a child can do, okay? So, number one, there are no prerequisites to AAC. Are they breathing? Yes. Okay, you know what? You're a candidate for a robust multimodal communication system. Not breathing, not a candidate. That's your prerequisite. You need to be breathing. Right? There's nothing else. You need to have access at all times to a communication system. So again, as a parent or even as a member of a school team, these are some things that there are just some glaring sort of, I don't know, I'll read this. Okay, so it's never okay for an AAC communicator to be without a voice. It's never okay, right? Yet in school systems, we see AAC being locked away in a cupboard, right? It doesn't come out of the backpack. It goes home at the end of the day, and whatever was said last night or in the morning is still there, and the charge hasn't changed. And you know that this has not been used. It has not been taken out all day, right? This is not okay, okay? Oh, and sometimes there's silence during class because the teacher doesn't like it's too loud. Right? Are you silencing the other children who can use their voices? No, you're not, right? Sometimes they're left behind, the AAC is left behind if the child is on the playground, or it's left behind if they're at the swimming pool. And again, this goes back to let's have a system and not one thing. If you're at the swimming pool, let's design something that goes in the swimming pool, right? If you're on the playground, you can take a low-tech system out on the playground. That's perfectly fine, right? But you don't do without it. So one thing you'll never see in a school, you'll never see a child have their glasses taken away. You'll never see a child have their wheelchair taken away. But you will see AAC systems being locked up all the time or left behind, okay? It is not okay, ever. There should always be access. Or hearing aids, right? Can you imagine taking a child's hearing aids? But AAC systems and cupboards from these two ladies back here are still in the system? Yep. All the time. All the time. Okay, so to have a system available at all times, and these are things that you can communicate to your team, right? Make sure it's always charged, make sure it's turned on, make sure the team knows how to do that. And make it clear that I do not want this system to be left behind. It does not get locked away, it does not stay in the backpack. If we go out, it goes out, okay? And if you're afraid, like it's a valid concern, I think, for a team to say, oh my gosh, this is like $25,000, I don't want to take it here. Fine. We can make you a low-tech system that goes with you, okay, so your AAC doesn't get left behind. You want the AAC to be going across all those contexts, right? All the different environments a student goes into, the AAC needs to go. We'll find a mount, we'll find a strap, we'll find a case, we'll find a low-tech solution, okay? And again, here's where your paper-based tools come in. Let's have some paper-based tools available. You have to teach them. And I'm going to go back, it kind of goes back to your point about where they will deny you because of not having met certain prerequisites. I've seen those forms. I know what they're like. And so I think we'll talk a little bit about the process of getting advice because it takes time, right? Have a way for your student to ask for that communication system and even a way for them to indicate which one they'd like to use, right? And you can do that just with a little strip, right? It could have a little picture of the low-tech board. It could have a picture of the high-tech, like the high-tech device that you're using. It could have a yes, no on there. Do you want to use your book right now? If they're looking at the book, then that's what you get, right? But have a way for them to say, where's my communication system? I want my communication system, okay? And if there is a time or a place where that AAC cannot go, then have a plan, right? If you know you're going to go to the splash park and you're not taking the Toby to the splash park, then you need a plan for what needs to go with you. You need to have something that goes with you to the splash park, okay? Okay, number 3, communication is multimodal. So there are many ways to communicate. They're all valid. One of them is not more valid than the other, okay? And there are several reasons why we want to have a multimodal system. First and foremost, high-tech systems run out of charge eventually, so that could happen in the middle of the day. You might have to plug it in, and that means it's staying where it is while it's charging, right? So when that happens, you have something else that you can use. Also, they will break down, and sometimes when you have to send a device back, say, to SETBC, Anne-Marie, it can be like 4, 5, 6 weeks or longer, right?
Especially if this has to go back to the States.
Yeah.
Then you're looking at a couple of months sometimes.
A couple of months, you don't necessarily have a loaner, right? So it's really good for your student to be familiar with a paper-based system and how to use that, because they will break down. They don't last forever. And then there are environments like the swimming pool, like this picture right here. That's a floaty board with AAC on it, symbols on it to use in the pool, right? I know in Surrey School District when I worked there, we always had a nice big fat ring of pictures for the swimming pool that were like extra laminated with a really thick laminate, so that there's no excuse. You can take this in the pool, right? I've seen empty water bottles, and on the inside of the water bottle, they wrap the symbols in there and it kind of floats on the pool with them. So, yeah, there's lots of ways to be creative and make sure AAC can be used wherever you are, right? And some of those environments that are tricky, it's okay. We can still use AAC. And if any of you guys are on Instagram now and following some of the AAC and AT innovations that are out there are just great ideas for incorporating AAC. Teach yes and no, right? It's a process, but it can be done. Create a communication dictionary. So a communication dictionary is just a little paper document that tells others